This is a knee. As a clinician, you'll see knees in many different ways, ranging from elite athletes to arthritic 90-year-olds and everything in between. Throughout this series of concise 3-minute videos, we will meticulously dissect every aspect of knee anatomy essential for musculoskeletal clinicians. The knee joint is made up of 4 bones: the femur, patella, fibula, and tibia. Patella means little dish in Latin. It is very important that you know this. These bones of the knee form 3 joints, combining each of their names. These are the patellofemoral joint, the tibiofibular joint, and the tibiofemoral joint. The patellofemoral joint is important to know as you'll see it most commonly as a clinician. The patellofemoral joint is a plane joint that offers both rotation and hinge capabilities. The tibiofemoral joint is a hinge joint that offers both knee flexion and knee extension. And the tibiofibular joint is another plane joint that allows the tibia and fibula to glide over each other. Each of these joints work together to provide the knee with the basic movements of flexion, extension, and very slight rotation. There are some useful bony points to know on the knee, and I'll give you the full names and simplified names that I use in practice. You have the tibial tuberosity, which I shorten to the tib tub. This is a bony prominence at the top and centre of the tibia, just below the kneecap. This is important in a few MSK conditions due to its overlapping with the quadricep muscles, which I will cover later in this series. Next, you have the lateral and medial condyles of the femur. I'm sure there's an innuendo here somewhere, however let's just say it looks like an upside down shaped heart. It's important to know the difference between lateral and medial if you don't already. Just remember medial is towards the middle of the body. On top of these condyles, you have a bony prominence called the epicondyles. Epi just means on or over, so this is essentially just the point on the condyle. Finally, you have the head of fibula. I don't need to explain this one. You can find it on yourself on the lateral side of your knee, typically at the same height as the tib tub. You should feel a bony lump. Some important pathologies that relate to the bones of the knee include osteoarthritis or age-related changes, patellofemoral joint pain, which is literally what it says in the name. This can be very difficult to manage if the cause is unknown. And the hardest one to say is Osgood-Schlatter.
Osgood-Schlatter.
Very common in sporty adolescents, involves the bones growing quicker than the tendons, causing pain on the tib tub. Red flags to have in your mind for the knee bones are cancer, fractures, and infection. Thank you for watching this video. Leave a like and subscribe if you enjoyed, as I plan to make a lot more of these quick anatomy videos in the future.